This is a Rogue Media Network podcast.
Welcome to the Fee-for-Service Dentist Podcast. Today we talk to Dr. Gina Marcus. You're really going to love her. She is a beauty, and she is full of vim and vigor. I mean, she is committed. You can tell she's an all-in personality, and she's also a take no crap personality. So I really enjoyed this. And she's into dermal fillers and cosmetics. She practices in the Miami area and Coral Gables, which is anybody that knows is a very nice area. And how she got where she got. And she is not afraid to step forward and think outside the box, work outside the box, and do things outside the box. And she's going to make her path. And I just love her. So it was a great conversation. I think you'll love it. Fee-for-service practice too, by the way. And she'll tell you that she dabbled in insurance. The only person I've ever heard, she went in and then she went out in 9 months. She thought it was going to be a game changer to improve her practice. Immediately knew it was the wrong decision. I'll let her say it. Listen up closely. Our podcast brought to you by Kettenbach Dental. As always, a big sponsor of our program. So they are very excited to announce the first major advancement in fluoride varnish treatments. It's called Profacil. It no longer has alcohol or resin. Instead, the patients will want this in a muco-adhesive dimethicone gel, which leaves a smooth, silky, and lubricious feeling. No more grit. Contact Kettenbach today, 877-532-2123, or visit kettenbachusa.com. Like the podcast, please. If you do, please click like, share it with your friends. That's how we get bigger, and that's how we continue to grow this baby. If you don't like it, well, please tell me. sunnyspirit@gmail.com or 607-624-2962 is my cell phone. You can reach me most anytime. Text me, whatever you want to do. All right, sit back, relax, enjoy the show. Thanks, everybody.
My name is Drew Burns, and I'm a part of a small group of dentists who believe something crazy. We believe the standard of care is just not good enough. We demand the best of ourselves and the best for our patients. We believe that the best way? No, the only way to practice dentistry is on our own terms. If you ask the dental consultants or the corporate CEOs, they tell you that what we're doing isn't smart, that fee-for-service dentistry is dead, and that the golden age of dentistry is over. Yet, while others focus on profits first, we focus on the patient first. And yet our offices are some of the most profitable in the entire country because we invest in ourselves and we are doing things right. It's our name on the door and it's our reputation on the line. My name is Drew Burns and I am a fee-for-service dentist. This is the Fee-for-Service Dentist Podcast and these are our stories.
Welcome to the Fee-for-Service Dentist Podcast. Today we have a special guest, Dr. Gina Marcus. Dr. Gina Marcus was referred to us by our lovely good friend, Dr. Nicole Vane. She said, probably want to talk to Dr. Gina Marcus. And you know how Nicole gets, she got going. So I was like, absolutely, because she's just given us so many great contacts and people. And her story, I think, is going to be really interesting. So I can't wait to get to it. Let me give you some background. She is native to Miami, Florida, graduated from Tufts University of Dental School. I think that's 2 in a row for Tufts on the show now. Boston, Massachusetts, where she received her DMD. She believes that a healthy mouth is a gateway to the healthy body and provides the highest level of care in general dentistry, Invisalign certified, comprehensive dentistry, and facial cosmetic injectables, which is interesting. We haven't really talked to anybody about the injectables, so be curious how that works. I know in New York State, it's not really acceptable unless it's dentally related. So we've kind of had that question. Her approach to create facial balance and harmony. So if you add all those together, comprehensive, cosmetic, injectables, Invisalign, you can kind of get an idea, right? She's a member and active participant in several prestigious professional organizations. She's a key opinion leader, KOL, to the board of American Academy of Clear Aligners. And then she is nominated to become leader of the Miami chapter of that same local study club. Later selected to represent the study club executive committee at the AACA. She represents and speaks at the AACA convention in Las Vegas, earned her fellowship in that, and is a graduate of Diamond Club Makers, which I don't know what that is. Staying involved with all aspects of dentistry and frequently attending seminars for CE. And I think that's one common vein. Most of the people that are in the fee-for-service world are committed to excellence and improving themselves. So I love this. And this is the first time I'm reading this out loud, folks, so you can tell. Dr. Marcus has been published in the AACA journal, today's FDA magazine, featured in the book The Beauty Prescription, and in the medical journal of Facial Plastic Surgery. That's pretty cool. Dr. Marcus believes that giving back to her community is critical to being a professional. She's participated in philanthropic ventures beginning in elementary school and in high school, college, and dental school, and now in her private practice. I love it. She enjoys spending time with her children, Benjamin and Jordan, her family, friends, running, traveling, and listening to music, mainly TS. And then says, if you know, you know. I don't know. I'm gonna have to wonder what TS is. All right, so accolades and accomplishments. If you're watching this show, you can see her little Dolphins flag in the background, which as a Bills fan, I find offensive, but that's number one provider of Invisalign to the NFL player program, lectures and all over the place. Pay opinion leader, like we talked, elite Invisalign study club, panelist for New Dentist, Nova Southeastern University, which is cool. I'm so glad you're doing that because I think we need to help the dental profession in general. And as you can see the philanthropy and you can just get a taste of it, I get it. I knew you'd do something like that. And Killer Network of Outstanding Women founder. Oh, that is awesome. KNOW, the Killer Network of Outstanding Women. She's the founder, 2012. Top 40 Dentist Under 40 in Benko's and Sizalage publication. Spear Education and Spear Study Club. And level 1, level 2 Botox, dermal filler, etc. So let's welcome Dr. Gina Marcus. Gina, how you doing?
Great. Thanks for having me.
That was awesome. I'm intrigued by a bunch of these things. Hopefully we'll get to. There's so much to talk to you about. So much. I really want to make sure that we hit on it, but I got to start with music, mainly TS. What's TS? What's that?
Taylor Swift.
Oh my God. You're a Swiftie.
I am
I
a
had no
Swiftie.
clue.
Yeah, you see,
I'm
I
not
did
one
this
of the
when you weren't
12
looking.
billion people. Oh my God. Oh, all right. Okay. Well, that's cool.
Yeah.
That's all right.
I'm traveling with a girlfriend of mine to Italy to see her this summer.
You are a
So,
Swiftie, indeed.
yeah. Yes.
Her song, this is a completely weird thing, but I was watching, they were interviewing Little Big Town as a country music man.
Mm-hmm.
And they were talking about the song Better Man and how it was a Taylor Swift song. Either she wrote it, recorded it, and how they had to make it their own. It was just kind of interesting. And their talk about Taylor Swift as artist to artist was so admirable. So I guess I should appreciate her more. I've only heard a few songs that I recognize. Otherwise, she's okay, you know.
She's not for everybody, but those of us who love.
And so. you love, I get it. Yeah. All right. So you're a Miami resident. Okay. Going to Tufts had to be hard. That's getting out of the warm weather. So yeah. Talk to me about your influences early. Talk about your family life. What was that like?
So I don't have any dentists in my family, but I greatly admired my grandmother. She was an Allstate agent. She was the first female agent in the state of Florida, and she was the first female Jewish agent in the country. And that was really big for her time. She grew up in the Great Depression. She wanted to go to law school, and her parents were like, nope, your brother wants to be a doctor. He's going to medical school. Sorry, you have to go to the family business. So that's what her family business was. So I got to watch this incredible woman, I don't want to say compete, but make her place in a world of men, which was very, very, very difficult to do at her time. So I watched her in her private office, how she dealt with her team, and how she did not do as great of a job with her team. So I grew up working in her office and watched all of that. So I kind of got the do's and the do nots of how to run a team. So when it came to be, me deciding what I wanted to do, I knew that once I decided dentistry, it was private practice all the way, and that I was going to have this amazing, incredible team, kind of similar to what I saw her do in her office. Other than that, I volunteered in many dental offices in college just to get a feel for it. So I was in college at University of Florida in Gainesville, and I shadowed with Dr. Patricia Webb, and she is a hoot if you know her. She is the typical Southern female, dentist who just runs the practice like a family. So again, I have that theme kind of running through my early influences. I also worked with a pediatric dentist. He was actually my pediatric dentist. That's Dr. Mark Webman. He's passed away now, but I worked with him, summer times, and I realized with him that I was not going to be a pediatric dentist. But just the way that he spoke to the parents and the way that he was able to connect with them, I learned a lot from him from that.
Okay. Well, very strong. What I'm kind of sensing too is, right, female lead, strong, independent business owner, and well, I don't want to say, well, yeah, I'm going to say, yeah, Maverick. She was the first one, said first woman agent in that area. But you also have that entrepreneurial spirit now too, right?
Yes, I do.
Yeah, that's a great role model. I mean, was your family connected? Like, did you live with your grandparents? Were they just close by? What was the proximity?
We always lived like 5 minutes from each other. Yeah.
Okay.
Yeah. And
That's
my mom worked for my grandmother.
That's
So,
Italian. That's Italian
yeah.
Jewish. It's the same. We connected that beforehand. So folks, the dots are connected. So what a tremendous inspiration too. So when did you say dentistry? Where were you? In high school? Were you in college? Where were you?
So I always thought that I was going to be like a physician pediatrician.
Okay.
Always.
Yeah, me
From
too.
the time I was 3 years old. My mom, there's a picture of me like helping this little boy that had fallen down clean his wound. And I would always say that I was going to be a pediatrician. Somewhere in maybe like last year of high school, first year of college, I was like, diarrhea, runny nose, strep throat, cold, vomiting. I don't want to deal with that on a regular daily basis. And I definitely don't want to deal with the crazy parents that come with that. And now that I have become one of those crazy parents, I'm super glad that I didn't choose that. So I've always been interested in art. I have a deep interest in art, physical art, painting and drawing. And now I've gotten into some digital work, doing resin work right now. It's all over my dining room table back there. And I said, what can I combine those two loves with? And I took this aptitude test in college, and in every single section, it came out dentist. So I was like, oh, well, that kind of makes sense. And of course, my dental school entrance essay was about how I had retained baby teeth, and I thought I was special because I thought I was the only one, and I soon learned I was not. But it was just really cool. So I was able to connect like all of these little pieces of my life together. And I really love what I do. I really, really love it. So for me, it's fun. Class 2s are not the most fun, but the rest of it really is a lot of fun, and I really enjoy it. So, yeah.
I don't know why people get so buzzed up about class 2s. Anyway, all right. So where'd you go to college? Where was college?
University of Florida, Gainesville.
Oh, of course, you're not going to the cold weather till you get to Tufts.
No. Yeah.
Now, what dental schools were you looking at?
So I looked at University of Florida, but I definitely did not want to stay in Gainesville. And I had a horrible experience on my interview. I interviewed at Tufts, I interviewed at Nova. And once I saw the program at Tufts, I was like, well, it really sucks that it's going to be really freaking cold, but this is the best fit for me. Their program is also more like a family. And I felt that on my interview.
Wow.
Nobody's ever said that. Yeah. And so it's funny because I felt that on my interview so strongly that when I went to Tufts, I became part of the admissions committee, and I was on the admissions committee for the 3 years that I was allowed to be after my freshman year. So just, I don't know. I saw it, I felt it, I picked at it, and that was kind of it.
That's nice. That's really nice. Now, when you're in dental school, did you think prosthodontics? Did you flirt with anything?
I did not.
Okay.
I knew that I was going to go straight to general dentistry because I wanted to have the choice to do whatever kind of dentistry that I wanted to do. Okay. Everybody goes into dental school thinking that they're going to be like an oral surgeon or an orthodontist. I kind of didn't, because that's where we're like all of it. You get your third wisdom teeth out.
Yep.
Late high school, early college. And everybody wants to be an oral surgeon. Not, I just wanted to enjoy it and see what was going to be my thing. And I really did like Crown and Bridge a lot. And I really loved implants. We were the first class to learn about implants and to do them as part of our requirement. And implants are a big part of everybody's practice these days. So I'm really glad that I had that early on.
When did you, what year did you graduate?
03.
03. Okay. The year that Syracuse won the national championship. Let me just throw that out there. Okay. So 2003, you graduate and you know what you want to do in terms of private practice. How do you find a job or in a position? What was your next career step?
So the summer after dental school, while I was waiting to take the boards and waiting for my results, I basically went online, searched every dentist in the area, and made cold calls. I said, I would like to work with you. This is what I'm thinking that I can do.
Now, in the area, you said, so that's Miami?
Yeah.
Where are you from?
Yes.
And then when you got to take the boards, you got to take the Southeast regional boards, or did you take what?
So back then it was the Florida board.
Okay.
We took the NERB up in school.
Right.
I knew that I was just doing that for practice. I knew I was never going to practice up there.
Okay.
So I took the Florida board, and at the time, the only place that they were giving the exam was in Gainesville.
Okay.
So I went and stayed with Patty Webb, who I had already interned with during college. She gave me the patients, which was fantastic.
Huge.
She was a great mentor. Yeah, she was a great mentor during that process. And I stayed with her, and, again, a family situation. I know her kids very well. And then I helped her two boys get into Tufts later on. I wrote them letters of recommendation because I've known them since they were little. And now they're both practicing. One of them is practicing with her. The other one's an orthodontist in North Carolina. So I cold called. I marketed myself.
So
I went on interviews.
Let's say it again, because this is an interesting thing. I see this so much online, and it kind of bugs me. There was one person that said, I work 2.5 days in a fee-for-service practice. I make $120,000, let's say. I forget the numbers, but I have my children and family 2.5 days a week, and they were like burnt out, and I was like, are you willing to do what you got to do? Like, are people allergic to work? So here you are, highly educated, bright, intelligent, pretty young woman, and you know where you're going. You've got great role models, etc. And you're going to pick up a phone, right? Like a telemarketer, and you're going to cold call doctors' offices, which I know is a pain in the ass. And you're going to say, hey, I'm looking for a job. Do you have anything? Right? I mean, you've got chutzpah. I like it. So go ahead. So you're not afraid of it. So
I'm not.
Kudos.
I learned my work ethic from my family.
Yeah.
Everybody in my family is a hard worker. So, I grew up, I don't want to say with not much, but I had just exactly what I needed. Nothing more, nothing less. And so I learned to do without, and I learned how to go and get things that I needed to do and needed to get done. I just figured out a way to do it. Like in my family growing up, there was no other way to do it. So I cold called, you're looking for somebody, and I went on several interviews. I did start with the Tufts grads first. I didn't end up with a Tufts grad. I ended up with an amazing human being. That was Dr. Phil Gladstein. He's also passed. He was working at that time. Let's see, he would have been like in his 70s. And so my question to him was, what's your phase out plan? And he says, when the ambulance leaves the office. And I said, you know what, this is going to be a good place for me to learn. Okay. It may not be the place I stay forever, but it's going to be the place that I stay to learn. So
he was totally open to it. He was like, great.
Totally open. Yeah. He wanted to share his knowledge. He was of the age where he practiced dentistry in the army in Korea in the middle of nowhere, figuring out how to fix teeth. And, I wanted to learn all of that, hands-on stuff, and MacGyver stuff. And he taught me a lot of that stuff. He taught me how to fix some of the, the dental chair stuff and the plumbing stuff. So I kind of am like that. I like to fix things. So I picked a lot of stuff up from him. And he was just a family type of practice, where he had this woman who was in her 80s at that time. I think she must be passed by now. But she had been working for him since she was a teenager. Like his whole, career, she was there. And then I tried to buy the practice. That didn't work out.
So wait. You buy the practice, mean buy into it or?
Yeah. So he was with a partner, and the partner initially had said, no, I don't want, his first right of refusal. He had declined it at first, but not officially on paper. So myself and the older dentist went into conversations with lawyers and, contracts and stuff like that. And we're literally about to sign contracts. And the partner's like, I'm going to take my first right of refusal. And I was out. So I wasn't going to stick around for that. So I did leave. At the time.
Well, now you're stuck between a spatting husband and wife, basically, So
yes.
Yeah, that's a smart move. That's a real.
So I was out. Yeah.
So
I was
now
like,
you're leaving. You got to go through the same process.
So I didn't go through the same process the next time around. My mother-in-law at the time was a dentist, and I never wanted to kind of step on toes because my sister-in-law is also, we all went to Tufts together. She and myself and her husband, we all were in Tufts together. Her husband is my endodontist now, and him and I were in the same class, and she was in the class ahead of us. And so I picked up the phone and I called her and I said, listen, I want to buy your mom's practice, but if you're ever planning to move back to Miami and thinking about going into her practice, I'm out. I'm not going to touch it.
Right.
She kind of gave me her blessing. She's like, I'm never moving back to Miami. And I bought the practice. And then 4 years later, she moved back to Miami.
Of course she did. I was just going to say, that's why I smiled when you said I never got, I was like, I can see where this is going. I can see where this is going.
So I bought my mother-in-law's dying practice because she had been phasing out. Her mother was ill, so she was out a lot taking care of her mother. So it was kind of an easy transition since I was the daughter-in-law and people, her practice was a very tight, very small, teeny, itty bitty, much smaller than I thought practice than when I purchased. And she took a lot of insurances. She wasn't, I don't believe she was on any of the lists, but she kind of, at that time, it wasn't as strict as it was now, as it is now.
Yeah.
So she would kind of like charge what the insurance charged. So there was never an issue. It was almost as if she was in.
She was just a people pleaser. She did whatever she thought made people happy. Yeah.
Yes.
She had no policies whatsoever.
Correct. So, and she had a paper schedule that all of the patient's appointments were written in pencil.
Yeah.
And the back of it, had all of the patients' names and their phone numbers. And the secretary that she had been her secretary for 25 years. And she had most of their phone numbers memorized because we did that back then. And so I took over that practice. And there I basically, it wasn't really a startup, but kind of.
How many rooms? Give me the physical layout.
So that's an interesting situation too. The place was 750 square feet.
Okay, it's a shoebox.
And it's a shoebox. There was 3 operatories. So
3 operatories in 750 square feet?
Tiny, teensy tiny. Like I had to go and have custom cabinetry made because nothing fit.
Okay.
And I would have to and I put things in there and we would bang our heads on the cabinets all the time. And I worked like that for 13 years.
Now she had, so 3 operatories. How many teams? She have a hygienist, she have front,
So she had herself, her dental assistant, who sometimes doubled as the front desk because sometimes she didn't have an assistant. So she either had one other person or 2 other people, just depending. When I came into the practice, it was just the front desk who doubled as an assistant. So, and she had been, with the practice for 25 years. So I kept her for exactly 1 year. And then on the day that I had to fire her, I had like diarrhea and stomach problems for the month before because it's the first time I'm firing somebody. It's very scary. You feel like you feel like you're ruining their life. And honestly, I didn't ruin her life. She went and worked somewhere else, and I found somebody. So she was doing her own hygiene, so I did that. The assistant that I hired at the other office where I ended up leaving came with me. And she helped me clean everything up in my mother-in-law's practice, order the instruments that I needed, order the composite, the bonding, everything that I needed. She ordered because she wasn't doing any crown and bridge at the time. So she
also had an idea of what you wanted the place to look like.
Yes. I knew it did not want to look like that. So she came with me. So I started off with just herself and me. And when I hired her, she always said that she wanted to go to hygiene school. So we're trucking along, and I found somebody for the front desk, and then she was my assistant. And we were all cross-trained, and we all learned Dentrix and, you know, that whole story. And then she comes up to me one day and says, I want to go to hygiene school. I'm ready. So I was like, cool, I will help you. I will pay for your instruments, because she couldn't afford anything at the time. I will pay for your instruments, and I will pay for the insurance that the school requires you to carry. You take care of everything else, and then you're mine. And she's still with me today, 21 years later. So yeah, she's pretty amazing.
Okay, so when you bought that practice, if you care to share, what were the numbers of the practice? Like, what was the practice doing? You remember?
To be honest, I didn't even look. So here's how that story went. The story was, homie at the other practice says, I'm taking my first right of refusal. I'm hysterical, pick up the phone, call my mother-in-law, because we're very close. And I'm like, you're never going to believe this. I want to have lunch with you. I have to tell you what's going on. I'm really upset. She's like, I can't. I'm selling my practice to someone, and I'm having lunch with them. And I literally said, cancel your lunch. I'll buy the practice. I don't care what it costs. I don't care what it looks like. I just need out of where I am. So she was like, are you sure? And I was like, dead serious, sure. And so so it kind of happened like that. And
but she had a price then. So she had a price and a value.
She had a price. And I said, whatever you're charging the other person, I will pay.
Yeah, it's fair.
Whatever it is. Because whatever you think it's worth, I want to pay what you think it's worth. I don't want to have special treatment because I'm the daughter-in-law.
How many years were you at the other place? How many years?
9 months.
9 months. So it wasn't even a full year. Okay.
No.
All right. But you got a chance to get your skills up, your speed up, et cetera, right?
Yes.
Okay. So you buy the practice, and now you're learning as you go, right?
Yep.
Obviously, it's not
making all the mistakes.
Yeah. Hey. But you're that's nothing for you. I mean,
no.
So okay, so now you get this. You have to free your mother-in-law up to do other things after a year. And what does the practice look like 2-3 years later?
Well, she actually left like 3 months in. So it was like, quicker. I was like on my own, like after 3 months.
Probably better because it's a small
It was. And you know, it was great because the patients weren't saying, oh, I want to see the other doctor. You know, I don't want to see you. They didn't have a choice.
Yeah, so but you're also, nice. You're independent. I could see that being a problem working with something like that.
Yeah.
Especially family. Yeah. And then you got.
Yeah. I mean, yeah, her and I never had a disagreement because she basically let me do whatever because she was so disconnected from dentistry and she was so preoccupied taking care of her mom that she just said, just kind of do whatever. And she kind of floated around and saw her favorite people their last time. And that was pretty much it.
You gave her a farewell.
Yeah.
Okay.
Yeah.
So
2-3 years later,
2 years into ownership, you've doubled the practice, I'm assuming?
It took me about 4 years to double the practice.
Okay.
Because there was a lot of people who were used to paying peanuts for stuff. Mm-hmm. And it was really difficult to continue because I wanted to work 5 days at that point. I'm like, I'm not married yet, or I was just married. I don't have any kids yet. I need to really work as hard as possible because I know one day I'm going to have kids and I'm not going to be able to work this hard. Mm-hmm. So we worked every day, and Wednesdays we worked 11 to 7. That built the practice. I can tell you, I can't even tell you the amount of people who appreciated those late appointments on Wednesdays from 4 o'clock to 7 o'clock. They were so appreciative of that time that when I got rid of it, those people left, and that's okay. That was okay. Because those were the people who are always, the most difficult. Somebody who's not willing to prioritize their time to come when the doctor is available, not always a good long-term patient. Mm-hmm. So, and I've learned that the very hard way over the years as well.
Okay, so you said she didn't necessarily accept insurance, but she sort of did. Did you? How did it take to get to the fee-for-service part? How long did that take?
It took me about the 4 years where I got to the fees where I wanted to be at. She wasn't doing crowns, so that one I snuck in with my fee from the old doctor's office. And at the time it felt like a lot because what she was collecting for crowns, the few and far between was like maybe 600 and something, 700 and something.
Right, but if you're doing like nickel and dime fillings, people are used to, I go to the dentist, it's going to be a couple $100. Now you're talking close to $1,000 or more whoa,
Yep.
now I need to have financial arrangements, you know, et
Hmm.
cetera. So it's a different mindset. I get it.
It is. It is. So I came in doing crowns at 1,200, which was at the time a lot. My crown fee remains high, but I practice in Coral Gables, which is like a very affluent part of town. Lots of business people around, lots of professionals around. I'm in a professional bank building, so I have professionals all around me. So people are, the fees are a little bit higher. And so people are used to valuing their dentistry.
Yeah.
So I typically have higher than the rest of Miami, but in Coral Gables, I know the guy who's charging the most and I know the guy who's charging the least, and I stay right in the middle of those two. So I feel like I'm giving them a really great service. I'm giving them my time and all of that good stuff. And it just kind of worked itself out. So you're asking about those first 4 years. There was a lot of back and forth with fees, a lot of discussion with fees. And so when I was able to double the practice at the end of those first 4 years, I decided, let's try the insurance thing. Because everybody was like, oh, you need to grow your practice. That's the way to do it. And I was like, that just doesn't sound right to me.
So this is interesting because we haven't had anybody do it. So at 4 years, you've doubled your practice. And now you say, I'm going to try to grow my practice, we'll say exponentially. So I'm going to add insurance. So you were insurance free at the time, and now you're adding insurance. That's interesting.
And it was against every grain of my being. Because I was like, this just doesn't make sense. It's not like you sign up and the people come. It's not like that.
So what'd you sign up for?
And that's what people, so I signed up for for Delta Premier and Delta PPO. And then whatever was underneath that Aetna ridiculous umbrella that you get all of the decent Aetna stuff, but then you get the really shitty stuff that comes with it. And I had no idea about those really shitty ones. So I learned that very quickly, and I was in network and then out of network in 9 months. I don't stay long when something is not working. And it just wasn't working because I was taking a lower fee than what I was getting. And I was seeing the same number of people only working harder because now I have to deal with all of these annoying people who don't really want to freaking pay.
Now, let me ask you. I was just going to ask you that.
It made no sense. It made no sense.
We'll call, I don't want to say attitude, but the demeanor of those people who think you're now working for them. What was that like?
It's exactly what you said. Like, I am a slave to them. I have to do whatever they say. And now you only know me for a little bit, but nobody tells me what to do.
Yeah,
like,
no shit.
Nobody tells me what to do. Like, and you're telling me what to do in my practice? No, not having that. So,
not leave with your teeth in your mouth.
No, for sure not. We are going to throw down, gloves off. So that was a struggle for me personally and professionally, to be perfectly honest. And of course, I wrote like this horrible letter to all of the patients, and that was the dumbest thing I've ever done in my entire life. And I got so much grief and heartache and headache from that stupid letter. It was basically like, pay your fucking bill on time. Arrive on time to the office or you're going to be charged. You miss your appointment, you're going to be charged. Like, it was one of those, like, let me explain you the rules of the game here. And that was a really bad idea.
So that was to everyone or just those insurance driven patients? I
sent it to everyone because I had it. It.
All right.
And that was a really big mistake. However, now I can look back on it with clear view, was probably super smart because I got rid of a lot of garbage patients. But at the time, I'm trying to grow my practice, so I didn't want to see people leave. We all hate when most patients leave. Some of them were like, woo, but there's other ones where you just are like, gosh, I don't know where I just screwed up. Yeah. When you think like, where did I screw up? What could I have done better? And we all feel that way, in fee-for-service dentistry, we get to have that feel with our patients. How can we be better with them? And so I went off of insurance. I had it. I sent that letter. It kicked right back in my face horribly. And I was like, I'm out. I can't take $39 from Delta for a cleaning when I was getting 92. Right. Like, I can't do that.
Okay.
So I went out.
So now, so within a year, you've added and then subtracted the insurance. You've also now potentially alienated some of your core. What does it look like at the end of that year? Are you at least on even with the year before, or did you still grow?
Yeah, I stayed even. I stayed even.
Okay.
Because
So
the
net
amount
zero?
that I lost, yeah, net zero, because with the attrition and the new patients, it kind of netted out zero. So, and then I continued growing a little bit at a time. And then I started with a consultant, because you go through the struggles and the strife of building an office and building a practice and building a team and blah blah blah. And then I had associates, and that was a disaster for lots of reasons.
And you're still in the 750 square foot office, right?
Yes.
Okay.
Yes. So so then that was in 2015. In 2014, I hired the consultant. She's like, associates have to go. You're working and paying them and not taking anything home, and you can't do that. And I was like, no shit. So she's like, they got to go. And so now I have to fire 2 people who I adore, which really sucked. So it took me a year to get the balls and practice to do it. I did it.
I'm surprised a little bit at that, but that's okay.
But they were my friends, so
I know,
it was really difficult. That was really difficult. Yeah. And again, you feel like you're ruining somebody's life, because they're so cozy and comfy, but I wasn't. I was very uncomfortable. And I was like that for a very long time. Because not only do I know what I want and I go and get it, but I'm also very patient. So I do put up with that from people that I love for a while until I can't anymore. And then I had that conversation. They left. The year that they left was 2015. And I did the same amount in 2015 because they left like January, February of that year. I did the same amount as I did before I hired them. So to me, that was not a loss, because of course, when they were there, the practice was doing more production, but I was taking home less. Right. So I did the same as before they were there. So that analysis worked out, pretty well. From there, it was kind of like, okay, now what are we going to do to grow the practice again? Because adding insurance didn't work. Adding associates didn't work. So what else is going to work? You got to buy a new practice. That's it. You buy an existing practice.
Okay.
So that's what I did.
Buy another influx of revenue. And what was the other practice look like? What was that?
So the other practice is also kind of like an interesting story. As you said before, I'm part of lots of local study clubs. So I walked up to one of the periodontists who runs one of the meetings, and I'm like, which one of these old gray hair white men is going to be retiring soon? And is going to be a good fit for me? And he said, that guy. And so I walked my little self up to him and I said, listen, not sure. But if you have, any plans in the next 2 to 5 years of phasing out of, dentistry, please, please, please let me be the first to know, because I would like to buy your practice. And he was like, call me tomorrow. Just like that. And unbeknownst to me, another girlfriend of mine had done the exact same thing. And I had just beat her to the punch, but like totally random, did not have any idea. So I ended up purchasing his practice, and he's an amazing human being. His wife was running his practice. So what I did was I folded his practice into mine. He was maybe like not even 2 miles away, but in Miami terms, that could be like a 20 to 30 minute drive. And they were knocking his building down. So he had to move no matter what. And he was ready to retire. He was ready to retire.
All right. So he wanted
to just been he was looking for the right person.
Right.
So, and he knew about me from the study club, but we didn't really know each other that well. We got to know each other very well. We had lots of dinners together. Me and my husband at the time, and him and his wife. I came into he didn't tell his team. And so he brought me in for lunch one day and was like, hey, I'm announcing that I'm retiring, and here's Dr. Marcus. She's going to take over the practice. And oh, by the way, we're moving to her office. So I took the wife with me and one superstar hygienist, and folded his, I think it was like 1,300 patients into my 800 patients, less than 800 square foot, 3-op, ridiculously tiny, cramped office. I threw everybody into the one. And the suite in front of me had been sitting empty for about 4 years. So I went to the management office and I said, this is what I want. I will take that space off of your hands and I want to build a new office.
Well,
And
you've
so
got
they
a
gave
lot
me
of leverage right now because they've been sitting empty for 4 years. So I hope you
yes,
used it. Yeah.
I absolutely did. I'm like, I want this, I want this, I want this, I want this. They gave me everything that I wanted just to get it off of their hands.
Sure.
So I
Some is
built,
better than none. Yeah.
yeah, so I built so that's where I am now. In 2017, it's 5 ops, 1,500, just a little bit under 1,500 square feet.
So almost doubled it in size. Yeah.
Doubled.
Doubled it
Yeah.
in size. You added, you had
Added 2 chairs.
7%. So, now you have a lot more capacity. And you have 2 hygienists probably full time, right?
I do. Yeah. Yes, I do.
And are you working? Do you have an associate now?
I do not.
Okay. So
I
you're a
think,
fee for service practice.
yeah.
Now, ballpark, what was that practice doing in revenue?
According to all of the paperwork, it was doing about $1 million.
Okay. And
at
you were
that
doing
time.
how much on your own? 600?
On my own, I was in like the 700s.
Yeah. So now, do you go to 1.7 or what do you do?
No, it doesn't go to 1.7 because there's attrition from the new
Right.
practice.
So there's about
So
20%.
it was a little bit higher because he had a lot of elderly patients
Yeah,
that were not
20
willing to make
and
the
it's a
extra
move.
trek.
Yeah. Yeah.
Yeah. So, and I lost some of the people who walked to his office, which I knew. So when I evaluated his practice, I'm like, okay, well, there's 1,300 patients there. What does it look like if only 600 stay?
Right.
So I based all of my math off of 50%
There you go.
retention,
Mhm.
and it still made sense.
Yep.
Because I bought the practice for like, I think it was 6 something. It was like 6
Okay.
something. So like 60%, let's say, of what he was doing. And I figured that that was gonna be no problem. And I had yet to hit $1 million. So I was
Yeah.
like, oh my gosh, I'm definitely on course for $1 million. I missed it my first year by just a smidge.
Mhm.
Maybe like 20 grand or something like that. And then the next year we went over $1 million. And we're on track now, COVID and all that other crap. This year we should be at 1.3.
Okay. All
So
right. Now
incremental, slow growth.
talk about how you got into the facial aesthetic stuff. How did you get into that? Because I've not had anybody on that's doing the injectables and the Botoxes and thermal fillers, whatever. Just talk about how you got into it.
So this is Miami. Like everybody does it. So I said, nobody gives a better injection than me. So there's no reason that I can't do that. And I want Botox and I don't want to pay more than cost for it. So I'll just get certified. And even if it means I do my own Botox, my family and my friends and nobody else, so be it. So I took this course in 2014 to get certified. And it was such a pain in the butt to get it through on the rider with my insurance. Now it's like a given. But I had to spell out all of the therapeutic uses. So I know you made that comment about New York, but there's so many therapeutic uses that you can get around the aesthetic stuff that that should not be the barrier. So for Botox is used on a regular basis by physicians everywhere for the treatment of migraines. And there's no reason why any dentist cannot use it for TMJ. There's no reason. TMJ the patients who come in for, I have like very strong beliefs. Patients who come in for TMJ are crazy. They are crazy. They are completely crazy. And when the night guard doesn't work because they don't wear it half the freaking time, when they're not doing their muscle exercises because they don't give a shit really, and they're complaining about how much all of that stuff costs, you give them a little bit of Botox and guess what? It's like magic because this calms down. It's like magic. So I always tell them, this is not Botox fixes the problem. This is, you got to do all of the stuff. You got to have teeth in alignment. You have to have, a plastic in between your teeth at night. You got to do the exercises. The Botox is just the icing on the cake, but it does take that edge off and makes them calm back down to somewhat normal because they're feeling relief. Whereas a night guard, sometimes it makes things worse before things get better. And we all have different views about different kind of night guards and blah, blah, blah. And I won't get into any of that. But the injectables have really become like a daily thing in my practice. So it didn't really explode until I took the course with Tracy Blessing, another Tufts grad. She went to work with her dad and decided this is like, I want to do injectables. So she made that her piece of the practice, and then she started teaching. And I took the course and I fell in love with Botox and fillers and how we can create facial harmony and how we can get these TMJ patients out of pain and how we can improve their smile. And really, dermal fillers, the way that she describes it is perfect. She describes it that dermal fillers in the lips and the nasolabial folds and all of the other little places that we put it and all the little touches that we do create a frame around the beautiful teeth that we were trained to make beautiful. If your teeth are beautiful, but around it, it's not framed properly. It's like you could have a Picasso, but if you just throw it up on the wall, it's going to look like nothing. You put it in this gorgeous frame, and that's going to make everything just that much more spectacular. So that's kind of the idea. And my patients know that I love it. I do it to myself. I did my own lips. I do my own Botox on a regular basis. And the patients love it. And, it means for them the convenience of not having to go to the dermatologist, not having to go to the plastic surgeon, not having to go anywhere else. They're already there for recare every 3 months. So Botox typically lasts like
cash on your practice?
100% cash, 100%.
How much would you say your practice derives their income from this service?
It's about 10%, but it's the most 10%. It's the most fun 10% of my day. So I enjoy it the most. Am I making the most? Is it a huge profit center? No. Is it a profit center? Yes, absolutely. Because I've learned how to do that. I've learned how to implement, and I've learned how to delegate everything except the injecting to my team. Like, they go in, they do the consult, they clean the face, they mark the face, they write down the number of units that we're going to place. I walk in, the syringes are already prepped. I'm literally in there for less than 2 minutes.
Okay. Now,
so it just makes sense.
Now, you're also very, very well established in the American Academy of Clear Aligners. You said the #1 provider of Invisalign to the NFL player program. So talk about, did you start with Invisalign? Are you doing more than Invisalign? Talk about that, because I think those two go hand in hand.
They do. So my Invisalign, I got certified in Invisalign in 2004. And Invisalign was a different beast back then, and it didn't really work that great. And in 2018, I took a course called Re-Engage with David Galler, and that he calls it the course that changes everything. It really changed everything. It kind of woke me up in a way that we look at ortho as like, yeah, we'll get to that. It's very interesting. He puts up two things on the screen. He puts up those gnarled lower anteriors with the perio and all of that crap. And then he puts up a tooth that's ready to explode with an abscess, right? Which one do you pick to do first?
Oh, you're asking me?
Most of us picked the one that was the tooth ready to explode, because that's where we're thinking. But that active infection is not an active infection. That thing's been there for 3 years. So are we really going to go in there and stir up trouble? Or are we going to straighten those teeth so that his perio problem goes away? That's a problem we can fix. That tooth is gone. And you know what? If we're fixing the teeth on the bottom or straightening out teeth and that thing blows up, so what? We pull it. Big deal. When it becomes symptomatic, we deal with it, right? It's been there for 3 years. It's not hurting anybody, right? It's not exactly like that, but it's just a different way of thinking about things. Like, why do we think that misaligned malocclusion is not important? It is important. Is it #1? Sometimes yes, sometimes no, right? So that's a decision you have to make for every single case. But it just ignited a fire in me that I was like, oh my God, yes, now it makes sense. So I made it part of my practice, and I went crazy with Invisalign, and I didn't know my patients wanted it. And when I started talking about it, and of course I have an iTero, so that helps. And we scan every patient, that helps. And we're finding all kinds of stuff. So again, the digital stuff has made its way in, and I use it every day, all day. And I love that stuff. I love the fix-it stuff, right? So it comes with all these cool little things, and it's got infrared and stuff like that, where you can see class 2 decay and all of that other crap. and you can time lapse things so you can see the difference in the recession year over year or 6 months out or whatever it is. And you can see how the teeth have shifted if they're not doing Invisalign and you want them to do Invisalign and they need to do Invisalign. You can see it shows them in yellow and red and orange and all those other shades of color exactly how much the teeth have moved. So that's kind of where my Invisalign journey started. And after the course, I just stayed taking the courses with David, and I made another family of connections that I really truly felt connected with. These were all practitioners just like me, fee for service, probably 70% of them, interested in Invisalign, interested in aesthetics, interested in being better at everything. So this like-minded sense of dentistry, it helps connect us, right? And from there, it just kind of was like, I talk to everybody. I'm just one of those people who I'm like friends with everybody. I talk to everybody. And I get this phone call one day from my great friend, Amir Daoud. And he's like, hey, I need to talk to you. And I was like, what do you need? And he's like, I want to tell you that we have picked you to be a KOL on the board of the AACA. And I was like, me? What did I do? He's like, you're involved. You are involved. You like this stuff. And we could use somebody like you to help make this thing better and grow this thing.
Hold on. How did you just push it yourself and all of a sudden you had a little bubble pop up with a thumbs up?
Oh, it's Apple.
Okay.
Apple, it's a new thing.
I was watching the show. I was like, oh, that's cool.
There it is. There it is. It's thumbs up. It gives you confetti back there.
All right. Okay. I got none of that. All right. Okay. All right. Sorry.
And this one I think does something too. I think it's balloons. There it is.
All right. Okay. All right.
So I got appointed to the board, like unbeknownst to me, everybody had gotten together and kind of picked me, and I had no idea. So that brought on a whole new group of connections and things. And that's how I got into the NFL program. That's how I got into the lecturing. That's how I got into the study club stuff. That's how I got into all of these kind of other things that are keeping me busy.
Okay.
Yeah.
So how much of your practice you say is Invisalign?
Like 30%.
30%. Okay.
Yeah. So 60% is still bread and butter dentistry. Which is why I poo-poo on class 2s, because they're like the least favorite part of my day. And it's always like a marathon of them in a day. It's never like sprinkled. If they were sprinkled, it would be so much better. But they're never
I don't
sprinkled.
think you ever do one. I mean, if you're doing one in the posterior, it's 2. It's usually that and the adjacent tooth.
No, that's not what I mean. I mean like the whole day.
No, I get it. But I'm just saying it's because a lot of the examples will show you how to use this material. They'll show you doing a DO on 13 and they're leaving 14 intact. Well,
yeah, it doesn't always happen that way.
It's not the real world.
Yeah.
An interproximal lesion doesn't just go to one side. Like it doesn't have a favorite. It doesn't go right. It goes right and left, So, all right. So this is, fascinating. So how about, I got to ask you about this killer network of outstanding women in 2012. Talk about that. Where'd that come from? Well, I know where it came from you, but how did that genesis of the idea?
So the idea was right around the time where the book Lean In came out. And a girlfriend of mine had given it to me and I read it. I ate it up in 2 seconds and I'm the slowest reader on the planet. So for me to read a book quickly, there was something in there that caught my eye. And in Miami at that time, there was a lot of study clubs that were like men only still. They were like boys clubs, right? So women could join if they wanted to, but we didn't because we weren't welcome, right? They would do fishing trips and like hunting trips and stuff that most women are just not interested in. So I said, well, how can we do something that's for us? So my girlfriend and I, Irene Marone, decided to gather a small group of about 15 women practice owners, some with kids, some without.
Owners.
And owners. Yeah. Well, because there's owner mentality and there's associate mentality.
I
and they
get
are
it. 100%.
So different.
100%. I'm with you. I just was
owners.
Emphasizing the owner. That's all.
Yes. Owners. And some of us had kids and some of us did not, which also is a big deal because in 2012, I had just had my second baby.
Uh-huh.
So time is tight. So I made time for this. That was like the first thing that I made time for. And basically it was a group of us. We would get together in a restaurant and we would share best practices. Like, what do you do that works for you? What is your HR plan for XYZ? What do you do? Like, what is your protocol for SRP? What is your protocol for whatever it was? And we just exchanged best practices. We also created a WhatsApp chat of, it's called We Don't Talk About It. And anytime somebody interviews somebody or fires somebody and finds like embezzlement or, you know, they were in jail or something like that, we just send their name into the chat and everybody knows not to hire that person. So I thought that was really cool. We still use it, that chat till today. We use it for all kinds of things like, hey, did you know about this new dental code and the CDT or whatever? And this is what you use it for. Or somebody had a question about, do we have to pay our employees for jury duty? So I know that changes every state, but just like little things. So, and we're a very tight group and we're all friends. We don't meet anymore just because life has taken a million different turns since then. But we did it for like 2 or 3 years.
Mm-hmm.
So, and we met like I think we met like once a quarter was the plan. And we would have an agenda and we would talk about things and, all that good stuff.
All right. So getting up against time-wise. So I'm going to ask you a couple questions now in terms of your business acumen and the fee-for-service. What are some of the things that you would like to share with our next generation of dentists, or maybe the people right now alongside of us, about what was the mistakes or what were some of the things you would advise them to do?
Oh, for the new grads, you have to be willing to work and do the procedures regardless whether you like it or not. Like, you can't say no to endo. A lot of these people that are interviewing, that I hear about it because I'm not hiring, but I hear a lot about it because, I'm talking to lots of people, all day long from all over the place. Oh, I don't want to do endo. What do you mean you don't want to do endo? That's like saying, I don't want to do class 2s. Well, somebody's got to do them. You got to do them. You're the associate. You're the newbie. You need to learn. So be willing to work hard. Take initiative. That is like so key. The people who are alongside of us right now, mistakes that I made, I would say if you're still in network with PPOs, please get out and phase it out. And there's a way to do it. There's a strategy to do it. Take the ones that are paying you the least, get out of those first, and then work your way through. Yes, you're going to have what we call Swiss cheese in your schedule. You will. It's going to be okay because you will make the same or more money because you'll actually get the fee that you deserve and that you have worked so hard to get. And your team will value you more. They really will, because they see that you're not willing to give it up for cheap, so to speak, being on those insurance lists. If you have an associate and you're making them see all of the PPO patients, you are losing 30%. You're losing 30% because you're already discounting your fee 30%. Then you're paying your associate on top 30%. And math only works in one direction. Is your overhead 60? The average dental practice overhead is closer to 75 these days, between the cost of everything and staffing and rent and blah, blah, blah.
Yep.
We're looking at, you're in a negative having the associate take your PPOs. So that is not a good idea. That was a mistake that I made, that I would say that anybody can fix. Mm-hmm. The associate has to stop taking the PPOs. You do too. The practice owners do too. It's a 30% loss. Like, imagine what your practice would look like with 30% more. And I don't mean more butts in the chair. I mean more money in the bank. Mm-hmm. So that's the thing that I hear the most buzz about.
Okay. Great advice. And don't write a letter that just pisses everybody off. That would be
no.
I would add to your list.
Oh my God. Don't send a letter when you're going off of network either. Do not send a letter. Don't send
Really?
a letter. Don't send a letter. Don't send a letter. Don't put anything in writing. No. Don't put anything in writing. A lawyer will kill you with that.
That's
no.
interesting. I think differently.
I don't. I think it's a conversation to have with every patient as they come in.
Right. I do. I mean, I also think it's not a bad idea to have it, and you word it in such a way because they're getting one from their insurance company, and the insurance company's letter is going to absolutely be slanted towards we're the good guy and that person is questionable in their practices and
they already
everything.
feel like that. I feel.
Yeah.
The patients already feel like that. A lot of them do. The ones that are insurance driven, they're already thinking that we're the wise guys.
Yeah.
And that the insurance, and I'm like, who has the private jet? Not me.
Yeah.
The CEO of United does.
Who has the tallest building in town?
I mean, so it's a conversation.
Okay. Now, last question I'm going to ask you is nothing to do with dentistry. If you could go back in time, anywhere, time or place, do anything with anyone, any experiences or meet anybody or do anything, where would you go?
Oof. Oh boy. Oh, I don't even know. I don't know. Maybe have more time with, I don't know.
You can go back. You can go back
know.
to beginning of time. You can go back 50 years. You can spend time with anybody. Do anything. It's pretty wide open.
I mean, I don't know. Oh, I haven't been asked an interview question in a really long time.
No, it's a fun one though, because anybody's first time, I always ask them the same question, and it's fun to. And I'm actually going to collect all of the answers and put couple little clips together as for fun, because each person their own personality, whatever it comes to me, it's I would tell you, the only thing I would advise you, what first thought that came in your head, that's it.
I mean, the first thought that came to my head was my grandmother, but I just want to spend more time with her. Yeah. It just wasn't enough.
I was expecting that. I really was.
Yeah, it just wasn't enough.
When you're struggling with it, I was like, seems like a no-brainer.
I know it was the first knee-jerk thing that came to my mind. She's always on my mind every single day. She was a huge influence in my life, and yeah, I would spend more time with her.
Is she still with us?
No.
Yeah.
No. So
God bless.
Yes.
For what the time that you had and the influence she had. So she lives in you. She's gonna live in your kids. You're gonna see it every day.
I talk about her every day. Yeah. Every day.
But you'll see it. You'll see it. I mean, there's no question about it. You'll see things that in your family, you'd be like, oh my God, it's just like Nona. What'd you call her?
Grandma.
Grandma. Okay.
But the kids called her Nana.
Nana, yeah. And Nana is an Italian one too. That's what we call our kids. Nana Spira. Nana LaForte. Yeah. Oh, wonderful. Well, thanks for your time. I appreciate it. If anybody wants to get in touch with you, let's see. Did you share that with me?
Oh, I probably didn't, but I probably should have.
Yeah, just send it to me if you can, and I'll forward all this on to our producers and along with your headshot and really interesting. I've never talked to anybody that does the aesthetics component with the fillers and stuff, and just I could tell you're passionate about what you do and you're very committed. Or you're all in or you're all out. I mean, I get it. So you're going to be successful. So if you ever sell stock in what you're doing, give me a call. I want to buy some of that because I'm a believer. So I really appreciate your time in Saturday morning too. Thanks.
Thanks for having me. Thank you so much.
You got it.
Take care.
Take care.
Thanks for listening to the Fee for Service Dentist Podcast. If you would like to share your fee for service story, please fill out our contact form at ffsdentistry.com. Also, be sure to join our Fee for Service Dentistry Facebook group. For help starting your dental membership plan, visit dentalmembershipdirect.com and membershipmastercourse.com. Finally, for help with in-house financing, visit dentalfinancingdirect.com. And don't forget, your story is what you make of it. This is your name on the door and your reputation on the line. Thanks, everyone. We'll see you next time.
This has been a Rogue Media Network production.